This is Mitchel Zoler with the Global Medical News Network. Professor Rehm, you were presenting today the DALI and YLD analysis from the study that's been conducted in Europe. Could you talk a little bit about what you see as the clinical implications of those findings?
Yes, thanks a lot. I see two major implications. The first is we have to increase the treatment rate. Overall, only every 10th person suffering from mental and neurological disorders gets treated. But secondly, we also have to invest in improving this treatment. We need more personalized treatment, we need more personalized interventions, also preventive interventions. And only if we really improve the research in neurological and mental disorders, then we can create these new treatments.
Yes. And you were also talking earlier about the how important these numbers really bring out the importance of neuropsychiatric disorders on the impact that it's having on the DALIs and the YLDs in European citizens. Could you address that a bit?
Absolutely. Overall, about 40%, more than 40% of the disability of all diseases in Europe are due to either mental or neurologic disorders. In terms of DALIs, i.e. the years of life lost either from premature mortality or from disability, we have 1 in 4 of the men and 1 in 3 for women of the DALIs from all disorders are due to those two categories. This is by far the disease category which has the most disability and burden of disease associated with it.
Yes, more so than cancer or cardiovascular disease, actually.
Absolutely.
Yes. And so one of the conclusions that you and your colleagues drew from this was that there needs to be greater attention paid in terms of funding of research directed toward the treatment and more refined treatments.
Absolutely. The disability associated with a disease, of course, can be impacted by good treatment. The better the treatment, the more we improve the disability, the longer we can have those periods without the disability associated with the treatment, and in some cases even full recovery. However, this is a chronic relapsing disease, so what we are trying to do is, of course, increasing the time without disability, increasing the time spent without the disorder.